Welcome back to Today's Health. In this segment, I'm speaking with Julie Dickinson, Oncology Nurse Navigator for the Karmanos Cancer Institute at McLaren Port Huron. Julie, thank you for joining us today.
Thank you for having me.
Now let's talk a little bit about your role as the Oncology Nurse Navigator.
I try to connect with most cancer patients, but specifically breast cancer patients. So I try to connect with them early on so I can help answer their questions. Sometimes I don't understand what their treatment options are or who they have to go to or the next step. So that's where I'd like to start seeing patients then.
Can you give us some examples of how you can assist women who are facing a breast cancer diagnosis?
Sure. I think removing a lot of the barriers that people have. A lot of times they may not have transportation or insurance, or they're already worried about paying their utility bills, or they're worried about not understanding what the doctors are trying to say. So providing them with education, knowledge, so they can make an informed decision-making, consenting for treatments, knowing they have a lot of physicians and treatment workups they have to do. So trying to get them to get to their treatment. Nothing's worse than hearing someone, I'm not having treatment because I can't afford it, or I don't have insurance, I don't have transportation. I mean, those, I try to remove the barrier so patients can get those options. And then when I do see and assess the patient, if they do have some issues with home care, medical equipment, or psychosocial distress or something, I have referral system. I can contact the dietitian, social worker, billing, we have massage therapy. I mean, I can refer them to the appropriate people that can help.
When do you typically reach out to a cancer patient?
With breast cancer patients, for instance, I'll see them when they have their stereotactic biopsy. Before that, I'll give them my card. You know, if their biopsy is negative, great. They can still call me if they need anything. If it's positive, though, I connect with them sooner to get that process moving quicker. I don't want to delay. I don't want anything to interrupt that flow to get them the earliest treatment they can. So I usually also see them by telephone. I call them on the phone. I see them pre-op, like a Wismer before their mastectomy or lumpectomy. I'll see them post-op, where they've had a lumpectomy or mastectomy. I'll follow up with them the next day if they stay overnight. And I'll usually make a phone call about a week later to check and see how they're doing.
So you're there for them basically through every stage throughout the process.
Let's try to, yep. That's the goal.
Now we know that breast cancer not only affects our patients but also their families. How are we able to help them?
You know, the patients aren't just by themselves. You know, they have a family that impacts everybody. So having family or significant others involved in their care is really important. I want them to go to bring their questions, write them all down, go see their physician, go for consults, for follow-ups, for treatments. They need to be involved in their care to know what's going on and what they can do to help. We also do have a caregiver support group too. So while there's a women's support group, on the opposite side there's a caregiver support group. So women can come, and then the guys can come and get some counseling or support if they need to also.
That's great. What other types of information can you give to cancer patients?
You know, if you're a patient at Karmanos, we do give a portfolio. It's like a case. It has a handle and it unzips, and in there there's information on advanced directives about radiation, chemotherapy, your skin care, your nutrition, the resources available in this area, resources available at McLaren Port Huron. Support group information, and American Cancer Society, we get a lot of information from them. So if they have breast cancer with reconstruction, mastectomy, and lumpectomy, we provide all that information for them. So getting educated is one of the biggest priorities that I have. So we give a lot of information.
Well, Julie, thank you for all that you do for patients with breast cancer, and thank you for joining us today.
Thank you. Thank you for allowing me to share my information.
And thank you for watching. If you have questions or need a physician referral, you can contact us by calling 1-800-228-1484. You can also watch Today's Health, request a copy of our program, and access other reliable healthcare information by visiting our website. As always, tune in next time to Today's Health. Today's Health is brought to you by McLaren Port Huron.